Good morning. It is Friday, February 24th, and today is day 45 of the 60-day legislative session. We are only 5 days away from crossover day this coming Wednesday, and that means that any bills, excluding those related to the budget, that any bills have to be out of the House of Origin. So that means House bills have to clear the House by Wednesday, Senate bills have to clear the Senate by Wednesday in order to stay alive. So for those of you who are updating your bill tracker, you'll probably be able to mark a lot of stuff off starting on Thursday morning. But there has been a flurry of activity at the Capitol. Several big pieces of legislation are moving. Today, the Senate Finance Committee is taking up Senate Bill 150, which is the budget bill. We're interested in this because this is going to play a very important role in tax reform, and the House, the Senate, and the governor have been negotiating. So we're going to be watching that very closely to see if there are any indications coming out of the Senate Finance Committee this morning related to the state's budget. On the healthcare front, some big things happening. House Bill 2006 has completed its legislative action. This is the bill that breaks apart the Department of Health and Human Resources into 3 separate agencies. That bill has now cleared the legislature and is headed down to the governor for his signature. On the PEIA front, Senate Bill 268 is on third reading in the Senate today. Now, PEIA is the Public Employees Insurance Agency. It covers nearly 250,000 West Virginians and is a public insurance plan. However, it has been woefully financially troubled for the past several years, so the legislature is taking a very strong look at what they can do to make sure that PEIA is solvent going forward. Some of the key aspects in this bill is that it would require the PEIA Finance Board to get back to an 80-20 payer mix, whereby the employer would pay 80% and the employees would pay 20%. Currently, it is far from that, with the employer taking on a much larger share. So this legislation would require going forward that they get back to an 80-20 mix. It also would reimburse hospitals at 110% of Medicare. Right now, hospitals are being reimbursed at about 50% of Medicare, so it's becoming a major burden for the hospital community. If you'll remember back a few months, Wheeling Hospital announced that beginning in July, they were no longer going to accept PEIA patients, just to convey how big of a problem this really is. The other thing that Senate Bill 268 would do is if a PEIA-covered employee has a spouse who can get health insurance from their employer, then they would have to take their employer's option. Otherwise, the employee under PEIA would have to pay 100% for their spouse to be added to PEIA. This is common in a lot of health insurance programs, so this is really an update that we're seeing out of PEIA with this proposed legislation. Now remember, if it clears the Senate today, which we expect it will, it still has to go over to the House for some more work to it. So keep watching that bill. I think there's going to be a lot more discussion surrounding PEIA. Lastly, earlier this week, the House Economic Development Committee advanced House Bill 3403, which is the West Virginia's chamber bill on child care tax credits. This bill was different than last year's bill and would not be able to be used in conjunction with last year's bill, but it would give employers another option when looking to operate daycare facilities. Under this bill as written, an employer who operates a daycare facility would be eligible for a 100% tax credit based on their annual operating costs of operating that daycare center. The bill passed through the Economic Development Committee. We are working to get it on the Finance Committee agenda. We realize time is short, but this is an important bill. We are thankful, however, that child care has really become a top priority of the West Virginia legislature at large, and that they're seeing this as a major issue with workforce development in the state. So a lot of really big things going on right now at the Capitol. We're continuing to be engaged on a daily basis. As always, feel free to reach out to me if you have any questions whatsoever, and I'm happy to get back to you. And otherwise, thank you for your continued support of the West Virginia Chamber of Commerce.